Good morning, and thank you for joining me today. These are unprecedented times. The COVID-19 pandemic continues to affect the world. This is why I'm addressing you by virtual press conference today. And tomorrow I will chair a meeting of NATO foreign ministers by secure video conference. The first such meeting in NATO's 70-year history. Our response to COVID-19 will be at the top of our agenda. We will address the measures that NATO and allies are taking in the current crisis, while ensuring that we continue to deliver on our core mission, credible and effective deterrence and defense. This is a global health crisis. Our thoughts are with the loved ones of the victims and with all those who suffer from the pandemic. We thank all those who are on the front line, the remarkable health workers, and also our committed armed forces who are supporting the civilian effort. NATO is doing its part to help in this common fight against an invisible enemy. Our airlift capabilities have delivered significant amounts of crucial medical equipment and field hospital tents. Just this morning, a military cargo plane with masks, protective equipment, and other medical supplies has taken off from Turkey, heading to Italy and Spain, in response to requests made through NATO's Disaster Relief Coordination Center. Hospitals with spare capacity in Germany have taken patients from Italy and France. Doctors have traveled from Albania and Poland to help their Italian colleagues. The United States has delivered medical equipment to Italy, and the Czech Republic has donated 20,000 protective suits to Italy and Spain. Our newest ally, North Macedonia, is using a NATO crisis response system to coordinate across government. Across NATO, allied armed forces are playing a key role in domestic response as well. They are providing vital support to civilian efforts, including with field hospitals, transport of patients, disinfection of public areas, and securing border crossings. So when foreign ministers meet tomorrow, we will look at ways to coordinate our response even closer. We will consider how to use NATO military capabilities and structures even more effectively to step up and to speed up our support to national efforts against COVID-19. Because we are in this crisis together, and when we respond together, our response is more effective. NATO's core task is to provide security and defense for almost 1 billion people. So our primary objective is to ensure that this health crisis does not become a security crisis. Therefore, tomorrow, ministers will also discuss NATO's role in the fight against international terrorism, including our training mission in Iraq. I expect we will decide to enhance our training mission further, taking on some of the training activities currently conducted by the global coalition, helping boost the skills of the Iraqi forces as they continue to prevent the return of ISIS and other terrorist groups. We will also discuss what more NATO could do across the wider region to support our partners. Afghanistan will be on the agenda. As part of the peace efforts, we are reducing our military presence. By the summer, we should have around 12,000 forces in the country. No decision for a further reduction has been taken, and all our steps will be conditions-based. NATO will maintain its commitment to long-term peace and stability in Afghanistan. The situation remains difficult. So now is the time for the Taliban and all political actors to play their part. All parties need to engage constructively, honor their commitments, and ensure inter-Afghan negotiations can start. And we will address how to further strengthen NATO's political dimension. I have appointed a group of 10 experts, 5 women and 5 men, to help me in this process. Finally, we will welcome the Republic of North Macedonia as our 30th member at this ministerial. So even in difficult times, we continue to look forward and to stay united because our unity is our strength. And with that, I'm ready to take your questions.